So today I'm going to be telling you anecdotes about my 35 years of research into neonatal circumcision. Now, anecdotes are not science, they're just stories, but all research begins with anecdotes. And as one physician put it, if I were a patient in a hospital, I'd like to be treated like an anecdote. So I became interested in this issue in the mid-1980s. The first thing I did was write the American Academy of Pediatrics for information, excuse me, and I called two friends that I knew in school that were now a pediatrician and a cardiologist. The pediatrician explained that mothers who have to go through the daily retraction of the foreskin and cleaning under there construe this as fondling or masturbating their child. So in order to save the woman that indignity, I recommend circumcision. Now, if you think that this attitude is unique to my friend, keep in mind that when he was in medical school in around 1975, students were taught to retract the foreskin of the infants, and the AAP's Committee on Fetus and Newborn stated in 1975 that the social and emotional reaction of prospective parents to penile cleansing should be taken into account. In less than a week after my conversation with this pediatrician, I received information from the American Academy of Pediatrics, which included this pamphlet on care of the uncircumcised penis, which was, by the way, misspelled. And it says in this pamphlet, and it states that it is not necessary to retract any part of the skin in order to clean under it. So right away, at the very first of my research, I found there's something wrong with this picture. By the way, this pamphlet, first published in 1984, includes a section on the function of the foreskin. I'm going to read this section verbatim because, as far as I know, this was the first time that the American circumcision industry, and the last time, that they ever admitted that there was any function to the foreskin. So here it is verbatim. It states that the glans, which is the head of the penis, at birth is delicate and easily irritated by urine and feces. The foreskin shields the glands. With circumcision, this protection is lost. In such cases, the glands, and especially the urinary opening, the meatus, may become irritated or infected, causing ulcers, meatitis, which is inflammation or infection of the meatus, and meatal stenosis, which is a stricture or closure of the urinary opening. Such problems virtually never occur in uncircumcised penises. The foreskin protects the glands throughout life. Now, in a subsequent pamphlet, this one, that section on the foreskin was removed. I would suggest this was probably done under the advice of lawyers, because as soon as you admit that the foreskin has any function and you're systematically removing it, you're already in serious ethical and legal trouble. So the cardiologist that I interviewed, that was a friend of mine in school, had no financial interest in this issue, and he turned out to be quite opposed to circumcision. And his response to my question was, the only way you're going to get rid of this is to hit them where it hurts, in their pocketbook and their reputation. So I'll let that sit with you as it will. So I ended up spending one summer at the University of Utah Medical Library reviewing textbooks. Could we close the door, please? Textbooks and medical journals that went back to the early 1900s. By the way, articles that appeared during this time in the 1980s in the journal Pediatrics were concluding, almost every one, with this statement, that circumcision is not especially a medical issue, but a social custom, which begs the question, are physicians supposed to be acting as agents for a social custom? At some point, I heard about Marilyn Milas, so I drove to California and I interviewed Marilyn with about 9 pages of questions. Marilyn sent me home with a box full of material that included the video that she made at Marin County Hospital, which was a real-life circumcision. I have to tell you, I've been all over the world and I've seen some bad stuff, but this video was the most brutal, violent thing I've ever seen in my life. It took me more than a week to get through this video. I couldn't watch but a few seconds of it without breaking down in tears. I'm doing it right now just as a visceral reaction to even recalling this video. So let's take a look at what keeps this war against the genitals alive. Let's start with what I would call physicians' ignorance. Now, I don't mean they're stupid. My pediatrician friend was a bright guy. They're just uneducated. An example would be my friend's advice to forcibly retract foreskins, which was contrary to the policy of the American Academy of Pediatrics at that time, or doctors who request immediate circumcisions because of diaper rash, or nurses who, in an attempt to extract consent for a neonatal circumcision, say to mothers, "You don't want your baby to get cancer of the penis, do you?" Now, in all of my research, I've never seen a single case of penile carcinoma in a baby. And then there's what we could call willful ignorance. When I've offered circumcisers information on the anatomy and physiology of the foreskin, they often say, "No thanks." When I asked in an American Academy of Pediatrics conference why no information in their statement of 1989 was included in that statement, the task force, the woman that was in charge of that task force, Susan Blank, said, "I have an early checkout and a flight to catch. We can talk about this offline," and she ended the question and answer period. Well, of course she didn't want to talk about it, because if you openly admit that you're removing valuable parts from the body of a non-consenting patient with no valid medical indication for the surgery, you're already in ethical and legal trouble. And then there was a member of the board of directors of the Association for Pre- and Perinatal Psychology who said, when asked about circumcision, "I won't talk about it." I happen to know that Dr. John Taylor from Canada, his research was submitted to American medical journals for publication, in which he identified a new structure on the penis, the ridge band of the inner prepuce. It was rejected by American medical journals and was eventually picked up by the British Journal of Urology. In fact, a transilluminated picture of the ridge band was on the cover of that journal. When I presented Taylor's research to medical students at a medical school convention in Houston, there were students who said, "We don't care about anything that comes from Canada." And then there's Dr. Thomas Wiswell. We have to take him separately from everybody else. This is the guy who was a major in the US Army that pulled numbers out of Army computers and tortured the data into compliance with his theory. I call him Major Tom. I have names for all these guys. And I sing a little song, "Ground control to Major Tom," because he's way out there. None of his numbers match statistics from any other country in the world. I attended a conference at the University of California, San Francisco titled "Advancements and Controversies in Clinical Pediatrics." Now, can you guess who they invited to be the singular speaker about the controversy surrounding circumcision? Major Tom. Yeah. Which, of course, is a controversy in and of itself. In the question and answer period of his presentation, I asked, I have this verbatim because I recorded it, and by the way, I have a transcript of that if any of you want to take it home. I said, "Numerous articles from the International Medical Database indicate that the foreskin is an exquisitely designed, extremely complex, highly nerve-laden, vascularized organ that is very important. In researching this topic for 10 years, I've found in talking to 1,000 parents and hundreds of physicians that this information about the nature and function of the foreskin is not included in the dialogue with parents about this issue. My question to Dr. Wiswell is, do you believe physicians are obligated to share this information with prospective parents? And do parents have a right to know exactly what's going to be surgically ablated from their child?" As soon as I said the word ablated, the audience laughed. His response was, "I'm quite sure I'm familiar with the articles that you're referring to, Steve. These are opinion pieces." He called me Steve because I know Dr. Wiswell. We've had dinner together. My response was, I'm referring to primary research from peer-reviewed medical journals, and I'm sure if any of you read it, you would agree that these are really important parts of a male's anatomy, and a prospective parent has the right to know exactly what's surgically removed from their child. By the way, Dr. Robert Van Houw was at that same meeting, and he said that he counted 14 bold-faced lies that Wiswell included in his discussion. And then we come to the tactics employed by circumcisers to perpetuate the practice. First of all, they demean the intactivist and they demean the foreskin. Dr. Gerald Weiss calls intactivists kooks from California. Could I ask how many of you are from California? Okay, I guess he was right. I anticipated saying, well, he's wrong because we're kooks from all over the place. A nurse once asked me, don't you have something better to do with your life? Edgar Schoen described Frederick Hodges, a well-known circumcision researcher and author, as a cocktail pianist in San Francisco, when in actuality Frederick has a master or a doctor's degree from Oxford University. I interviewed the president of the Pre- and Perinatal Psychology the president of the Intermountain Urological Association. When I asked him, what is the function of the foreskin, he replied, a cesspool. In response to a question about men who were restoring their foreskins, he said, it just depends on how much you go around thinking about your cock. I would have to question their psychiatric integrity. A urologist from the University of Utah, a known proponent of circumcision, when I asked the same question, what is the function of the foreskin, he said, God only knows. It's just extra skin, a point of entrapment for bacteria, smegma, and infection. He also said that some men that I've circumcised claim that there's a diminished sense of sexual stimulation, and they come back bitching and moaning that they've lost sensitivity. But these nerve endings will generate in a year or two, and then they stop complaining anymore. Regenerate where? You cut off your fingers, the nerves regenerate out into space? I just don't know what he was talking about. When I asked if he was aware of any urologists who are performing female circumcisions, he says that he does a dorsal slit on females who request it in order to expose the clitoris. Of course, he's talking about the glans clitoridis, because the clitoris is the counterpart to the male's penis. A dorsal slit would involve cutting the superficial part of the clitoris to expose the glans clitoridis, evidently to facilitate, finding the glans clitoridis from some clumsy partner of theirs. In an American Academy of Pediatrics session on MRSA, the methicillin-resistant Staphylococcus aureus infections, I asked the presenter if there was any evidence of increased MRSA infections in circumcised infants in hospital. The crowd laughed again. She said, talk to the women on the street, which she was referring to the women who were protesting circumcision outside the hospital. The crowd then really had a good laugh. The microphone had already been taken away, but there were 2 studies that indicate that their MRSA infections in hospitals have a 7-fold increase in MRSA infections in babies that are circumcised. Another technique used by the circumcisers is to trivialize circumcision. A physiology professor at Utah Valley University described the foreskin as extra skin, and that's all he had to say about it. A physiology professor at the University of Utah, pointing to a diagram of the penis, which of course did not include the foreskin, says this is where the foreskin would be, and it's the part that's removed in a circumcision, and I think it's the law. There was an audible gasp from the audience, and one of the students said, no, it's not the law. And he said, well, I think it used to be the law. Keep in mind that this is the mandatory physiology class that would have to be taken by every pre-med student. And then there's the proverbial, it's just a little snip, snip. It's redundant, superfluous part of the body, nature's little mud guard that we needed when we were walking around naked through the thorn bushes. when in actuality the foreskin is an evolutionary advancement over higher primates, and its removal reduces the human male to a subsimian level of sexuality. If you want me to defend that statement, I can tell you why, if you want to talk to me later. And then there's the financial motive. A drug salesman told me about a conversation he heard between obstetricians and pediatricians about who was going to get to make the money on circumcision. A doctor from Washington State wrote in and said, "You think circumcision is of no value?" It put all three of my daughters through college. A physician from Arizona who bragged, "I can buy a new Porsche every year with the money I make on circumcision." Now, personally, I don't believe money is the prime motivator. I think the nurses of St. Vincent from Santa Fe, New Mexico, who refused en masse to participate in circumcisions, synthesized it perfectly. Circumcision creates circumcisers. What you do to children, they will do to society. And now how about hygiene? Are American men really innately too stupid to learn to wash themselves? A dermatologist friend told me that they really like to use foreskins in topical medication experiments because they're so clean. And the issue of pain. An obstetrician told me one of his professors in medical school told him, "You're going to be causing people pain, so you might as well learn to enjoy it." A pediatrician told me, "I don't use anesthesia because I don't want to add potential complications on top of what is already an unnecessary surgery." A pediatrician told me, "I don't use anesthesia because they scream just as much when I give them a dorsal nerve block as when I circumcise them." Now, a dorsal nerve block may eliminate the pain on the dorsal aspect or the upper side of the penis, but when you get cutting on the ventral aspect, the underside of the penis, the babies will begin to scream. The only way that you can guarantee complete pain relief in a circumcision is to do what they call a ring block, where you're infusing the pain reliever all around the penis, which this massive infusion distorts the operative field and creates the possibility for a poor surgical event or result. The Animal Welfare Act of 1986 prohibits experimental operations on animals without appropriate anesthesia. So we're treating our little baby boys worse than experimental animals. Not that anesthesia or pain relief is the issue here, but it's a critical part of course, what the baby experiences. Now, physicians have been taught, as we've heard, that babies are incapable of feeling pain. I'm going to wrap up this part of the presentation on pain with a quote from my hero, Mr. Rogers, who said, "Everyone has feelings. At all ages, everyone has very strong feelings." And that was confirmed by studies that were done in the 1980s that concluded that infants' response to painful stimuli is similar to, but greater than that of adults. And then there's our inability in this country to have open, honest discussions about sexuality. We're all aware of the fact that circumcision was exported from England only to English-speaking countries in order to eliminate masturbation. Australia got the criminals, Canada evidently got most of the comedians, and the United States got the Puritans. Now, Puritanism has been described as an abiding fear that someone somewhere is having a good time. When I would substitute for human sexuality teachers at the University of Utah while they went skiing, they warned me that I couldn't talk about sexual positions. In contrast, in the Netherlands, sex education is mandatory in high schools, and of course their STD transmission rate and teenage pregnancy rate is minuscule compared to the United States. While I was walking with Dr. Paul Fleiss through an American Academy of Pediatrics conference, his colleagues of his age were razzing him, saying, "Are you still obsessed with women's breasts?" because he was an early advocate of breastfeeding. Oprah Winfrey had a piece on demystifying the vagina. Her guest had a diagram of the vulva, which she erroneously referred to as the vagina, that looked like a stick figure of a man. Now, I know probably way too much about female genital anatomy, but I can tell you I had no idea what she was talking about. Now, just to lighten things up, I'd like to tell you a little joke from the Phil Donahue show. He was the first talk show host on television in the United States. A questionnaire at a Catholic boys' school asked students if they masturbated. The results were 90% masturbated and 10% were liars. So I'm going to wrap this up with a few more anecdotes that really don't fit into any of the other categories. A pediatrician told me, I like to do circumcisions because it's the only surgery they let me do. Another pediatrician said, I don't like to do them. I make the parents watch just to get back at them. Anyone who has manned a booth at the American Academy of Pediatrics knows this story. Pediatricians walk by, they usually don't come up to the booth, but they give us the thumbs up and they want us to know we don't do circumcisions, we just fix the botched ones. So there's pediatricians who gently dissuade parents from circumcising, but they'll go ahead and do it anyway if the parents want it done because they do good ones, which of course begs the question, who's doing all the bad ones? It's been reported that the circumcision industry makes $1 billion a year correcting the complications of circumcision. I asked an OBGYN who spoke out against invasive obstetrical practices why he dared do that, and his answer was, I'm retiring in a year. They can't do anything to me now. At an ethics conference, I debated a pediatrician who started his argument by saying, this is a difficult issue for doctors because we're not supposed to do harm. This fellow had essentially made the conclusion of my argument in his very first statement. I was tempted to tell the moderator, excuse me, could I relinquish my time to my opponent? And the old refrain, circumcision isn't a surgery, it's a simple outpatient procedure. Actually, they're right. A surgery is a manual or instrumental operation to treat a disease, a deformity, or an injury. None of these conditions exist in the perfect newborn child. But here's the kicker. Circumcision can cause a number of complications and diseases. I have a folder probably about this thick on the complications of circumcision. And then there's no question that circumcision deforms the body and injures the child. If you look up the word injury, one of the first words to describe it, that word is a wound. I can show you a medical journal article entitled How to Care for the Circumcision Wound. If you look up wound, one of the first words to describe wound is harm. Now keep in mind, we're talking about a profession whose prime dictum is primum non nocere, first do no harm. Instead, as soon as a physician can get his hands on a patient, in the first days of his life, he harms the patient, he wounds the patient, he injures the patient, and he deforms his perfect little body. And this individual is going to have to live the rest of his life with a denuded, desensitized, callous, scarified penis that will never function like a complete penis. To quote Georgianne Chapin, it's crazy that we don't think it's crazy. In talking to older physicians, when the first task force on circumcision was published in 1971, they thought routine circumcision would disappear like routine tonsillectomy. Edward Wallerstein, the father of the anti-circumcision movement, was asked on 60 Minutes why circumcision didn't disappear like tonsillectomies. He responded, because it's underpinned by sexuality and religion. And in the United States, it's become a social custom. Keep in mind, there's no greater legitimizer than social custom. Social customs take on a life of their own, and like any habit, they're really hard to break. But this social custom is so upside down, it violates all the principles of medicine, It violates what should be the most basic human right, the right to retain possession of all the body parts you were born with, and especially in this case, enjoy the functions of those body parts. I think a quote from Mark Twain puts it very succinctly, and I want you to listen to this quote. A lot of people who get attached to this issue, anyone that's done any research on this issue knows that as you go along, you just become more and more horrified, and you think, all we need to do is just tell people about it and it'll disappear. Here's the quote from Mark Twain. "Often, the less there is to justify a social custom, the harder it is to get rid of." It's kind of like all men are created equal, but we'll import black Africans as slaves. That kind of thing, which was around when Mark Twain gave this quote, and it could have been the inspiration for this quote. Now, I'm not counting on the trade unions that represent circumcisers to change their tune. Their job is to maintain this revenue stream, this cash cow for the members. But I do have faith in individual circumcisers. Dr. Benjamin Spock, who's been mentioned here, the famous pediatrician of the 1950s, in all of his books recommended circumcision. But later in his life said, "My own preference, if I had the good fortune to have another son, would be to leave his little penis alone." Dr. Leo Sorger, an obstetrician and the husband of our friend Elizabeth Noble, who said that when he learned about the foreskin's anatomy, mea culpa. A neighbor who got educated about the issue wrote the pediatrician that circumcised her son, and he wrote back with an apology. My new neighbor across the street, an ER doc who has 2 intact sons, said that he and his wife didn't believe that a sugar cube would eliminate the pain of circumcision. Now, Major Tom's recommendation is to dissolve a pack of sugar in water and dab it on the children's lips, and that's supposed to eliminate the pain of circumcision. Dr. Paul Fleiss performed more than 100 circumcisions and then spent the rest of his life working to end the practice in order, as he put it, to redeem himself. I gave 5 physicians copies of What Your Doctor May Not Tell You About Circumcision. I've run into 2 of them, and they both said that by reading that book, they stopped circumcising. So there is a way to end this war against the genitals. Physicians who are in a position to offer circumcision can simply explain to prospective parents that in light of what we now know about the importance of the foreskin, and given the right of every child to a surgically unaltered body, I can't participate in these surgeries. I'm going to finish with another quote from Mr. Rogers. "There's nothing more important in life." Excuse me, I really like Mr. Rogers. "There's nothing more important in life than to be important in the life of a child." So when someone asks you, "Don't you have something better to do with your life?" you can simply say, "No, I don't." So that's all I've got. Thank you for your attention. Questions? You're kidding.
We have time for one.
Oh, you're kidding. I timed this. I'm only 20 minutes into my presentation. Yes.
Where did you buy that one?
It's Steve. Excellent presentation. Thank you. And when you brought up the AAP brochures, I brought them up on my computer because I have them in my archives. And if anyone ever needs any proof that the AAP is committing fraud, all they need to do is look at the 1984 version, which you brought up, in which they misspelled uncircumcised. And the diagram of the penis is what they took from Edward Wallerstein's book. And it says, "Drawing reprinted with permission of Edward Wallerstein, comma, author of Circumcision, an American Health Fallacy, underscored." In the 1990 version, they just said, "Drawing reprinted with permission of Edward Wallerstein," and deleted the title of his book. There is evidence right there. They know they're committing fraud.
Yeah. Edward Wallerstein, by the way, was given the Medical Writers Award of the Year at some point in his career. By the way, he was the father of the anti-circumcision movement, and may I say, he was Jewish. Any other questions?
Do you know when we can?
So that one deleted paragraph from that 1984 brochure, do you know where it's available online, if anywhere? Or,
Tim's.
well, he says he has it on his disk, basically, but I mean, it's like, no, I mean, out and about on the internet.
It's
Okay,
right here.
that's what I was asking.
You can
Is it available
photocopy
online
it if you
anywhere or
like.
not?
Tim, email it to me and I'll put it on on social media, okay?
David, I don't think we have more time for questions.